Rasa sikit pun tajam. Apa masalah yang kamu hadapi sekarang ni ya?
Jom kita sama-sama praktikkan aja.
Introduction.
After eating bursitis, bursitis is a swelling or inflammation of a bursa, which is a synovium-like sac-like structure found throughout the body, near body prominence, and between bones, muscle, tendons, and ligaments. There are over 150 main bursae in the human body, and the function is to facilitate movement in the muscular system, creating a cushion between tissues that move against one another. When bursitis occurs, the bursa enlarges the fluid, and any movement against or direct pressure upon the bursa will precipitate pain for the patient.
Clinical manifestations. For the clinical manifestation of bursitis, you can have a localized pain. When you move or put a pressure on the area, the pain gets worse. Number 2 is swelling. An accumulation of excess fluid within the bursa due to inflammation results in palpable or visible swelling of the joint of bone area. Number 3 is warmth and wetness. If the bursa becomes infected, the area experiences an increase in blood flow, which causes the skin to appear wet and feel warm.
Okay.
For number 4 is limited range of motion. Pain and tenderness and swelling make it more comfortable to move the affected joint in a normal manner. Number 5 is crepitus, and it happens rarely. In chronic bursitis, thickened walls of the bursa and fluid may cause a crackling or grinding sensation when the joint is moved.
Management.
Okay, next we go to the management. First management is medical. First thing is medical. In medical is painkiller. Painkiller and anti-inflammatory drugs such as ibuprofen or naproxen to reduce swelling and pain. Second one is antibiotics. If there is an infection, antibiotics are needed. The nurse must watch for fever, redness or pus. Lastly is steroid injection. Sometimes the doctor may inject a small dose of steroid directly into a bursa to reduce inflammation quickly. So next we go to the surgical. The first thing in surgical is aspiration. The doctor uses a needle to remove fluid from the bursa to relieve pressure. And the second one is bursectomy. If needed, the whole bursa is removed through a small surgery.
The last thing in the management is the conservative. The first one is resting the joint, which is encourage the patient to stop any activities that cause the pain. Second one is cold compress. Apply ice wrap with a towel for 15 to 20 minutes, a few times a day to reduce swelling. The third one is positioning. By positioning and protection, you can use cushions, elbow knee pads, or soft supports to reduce pressure on the joint. And lastly is gentle movement. After the pain reduces, help the patient slowly move the joint to prevent stiffness.
The nursing diagnosis that can be related to bursitis is acute pain related to the inflammation of the bursa, as evidenced by the patient verbal report of pain and limited joint of mobility.
Nursing intervention.
For nursing intervention for bursitis, 1. Assess pain management to the patient. Rationale to administer other analgesics such as ibuprofen as instructed. 2. Encourage patient to rest and activity modifications. Rationale to advise patient to rest of the affected joint. 3. Educate patient about how to deal with the bursitis. Rationale to teach proper body mechanism and ergonomic principles. 4. Monitor for any complications. Rationale to avoid from worsening symptoms or signs of infection such as redness on the affected sites. Number 5. Supportive care to the patients. Rationale to assess patients with activity of daily living if the mobility is impaired. Number 6, encourage gentle range of motions exercise. Rationale to prevent joint stiffness and muscle atrophy or the acute pain substance. 7, provide positioning supports. Rationale use pillow or cushions to support the affected joints. Number 8, promote adequate hydration and nutrition. Rationale to encourage patients to have balanced diet to promote tissue healing. Untuk maklumat lebih lanjut, anda boleh tekan link di atas.
Thank you.